looking at shoulder range of motion, I will often look at the patient moving both arms by herself first. And so I'll go ahead and ask the patient to go ahead and flex her arms straight forward and up over her head. And again, I may watch for her willingness to move here and go ahead back down. And I may have her repeat that a couple times because I'm also looking for symmetry of movement through the shoulder blades. So as she go ahead and flex, I'm watching for equal upward rotation through the scapula, and as she slowly comes down, I'm looking, are they slow and controlled in their descent back to neutral? And then same through abduction, thumbs up and out to the side, go ahead and come up and over your head. And again, I'm watching, is she using a certain muscle group excessively? Is she shrugging as she goes into the top of that motion? Is one grossly different than the other? With both of these, again, just like we did for the cervical spine, you can have her go to the end of her motion, and you can apply overpressure. Good. And you can come back out. Now don't let me push you up. And you can apply resistance. So you can use the same pattern that we did with the spine, looking at active range of motion, passive range of motion, and resisted range of motion to try to narrow down whether the pain is coming from a contractile, non-contractile tissue. If we're looking at shoulder extension, go ahead and turn to the side. You're going to have her, again, as she brings her arm back into extension, you want to make sure that she's not moving her body to compensate. Make a note if it is, because that can be helpful, but you're going to have her just go ahead and reach her hand back towards me, and you're looking at available motion there. And again, is that causing any pain throughout the shoulder? And relax down. Good. For internal and external rotation, you want to have the patient lying supine. So I'm going to have you go ahead and lie on the table. And I like to have a little towel roll to bring the arm joint more into a neutral plane, so she's not excessively anterior through the glenohumeral joint. And I typically will stand right here. I don't want to block the camera. So what I'll do is passively bring her into external rotation here. I can have her also do that actively. Go ahead and bring your arm all the way back. And again, watching for any compensations, and go ahead and come forward. And again, especially with internal rotation, you'll often find people excessively moving their shoulder blade anteriorly. So what I want to see is how well does that humeral head rotate within the glenohumeral joint. I may just have a little helper hand just to see if there's any tightness into internal rotation. Again, you can apply the same rules using active range of motion, passive range of motion, and overpressure in all those directions.